Our anxiety might be at an all-time high right now, but there is a way to manage that anxiety. We have Lynne Sill and Paul Peterson here from the OCD Anxiety Treatment Center. Thank you both for joining us this morning.
Yeah, thank you.
Hi, thanks for having us.
Lynne, people with OCD and anxiety, what are they dealing with right now?
They are dealing with so much, along with the rest of the world as well. We know at the OCD and Anxiety Treatment Center that we specialize in anxiety and OC spectrum disorders, which is OCD, of course, and body dysmorphic disorder, and hair pulling and skin picking. And what really makes us different is that we are true specialists. We really are well trained, and we want to make sure that we don't just teach people how to deal with moments of anxiety, but instead we teach them how to change their brain, how to actually overcome anxiety and how to react different to anxiety. If you could imagine, if all we did is always react to moments of anxiety, people would always feel overwhelmed that they were just constantly treating that. And there are so many moments of anxiety right now, whether that's coronavirus or social, problems that we're having, or protests, or even an earthquake here in Utah. So people would be constantly managing their anxiety. So instead, we want to give them long-term effects that can make it so they are not just managing their anxiety, but instead living their life.
How many people with OCD or anxiety actually acknowledge it? Because I think sometimes you think, I don't have it. That's not me.
Yeah, there are a lot of people. I think most people, they just put their little smiley face on and pretend that everything's fine when they're not. And so, it's hard to tell who they are because they can be very functional. And so,
I was reading some of the information about your center, and you were saying that it's not just making sure your kitchen is perfectly clean or washing your hands a million times, that it can go deeper, that it can go into your religion, your relationships, things like that.
Absolutely. So OCD and anxiety takes the things that people really care about and it twists them in a way that makes them feel like it's a threat or a fear that they might be having. So instead, it really does take the things that you talked about. And if you can imagine, like I said, the things that are happening in the world are a threat right now. They are scary. And so it takes those even more and it amplifies those. It makes them even worse.
So you say that sometimes people can get a quick relief, but you focus on long-term relief for people like this.
Yes. So if you imagine, we've heard of deep breathing or mindfulness activities, those can be so effective in the moment, but instead we want long-term relief.
All right, so if somebody needs a short-term relief right now, is there a tip or a trick that you can tell people if they are suffering from anxiety or OCD at the moment, something that they can do immediately?
Yeah, well, there's a lot of things, especially with this COVID-19. It's really strange in our society. These things that we used to take for granted, we now are worried about them, such as like touching a door handle or going into a grocery store. And so, maybe instead of focusing on all the things that we need to do to protect ourselves, which is important, but we also maybe need to just put our phone down and stop checking the count of the COVID, and maybe instead we need to focus on, have a place for COVID-19, which is important, but not have it take our entire life. And so we can do things like take care of ourselves, eating and sleeping and looking for happiness in other things. And if that's not enough, we might even look at getting a professional that can help us get down that anxiety we're feeling.
It's so interesting, just putting your phone down, which I think even if we don't all have anxiety, it can make us all feel better just for a minute to do even something simple like that. We are going to put all your information on the website for Channel 4 because I think you're probably reaching out to people right now. I'm so grateful that both of you are on the show. That's the phone number, 801-298-2000. Thank you both for being here.
Thank you.
All right, coming up next, we're helping small businesses in this pandemic.
And feeling